name is Kaylan. I'm a registered nurse here at Gallaher Plastic Surgery and Spa MD. Today we are going to discuss how to properly care for your Jackson Pratt drains, also known as JP drains, and answer some common questions and concerns we hear at our practice. So as you can see right here, I have a JP drain. This is the part that goes into your body to catch the accumulating fluid post-surgery, and this is the reservoir, also known as the drain bulb. You will be instructed to strip these drains every 3 to 4 hours while you're awake. At your pre-op appointment, you received a drain log. A drain log is used to record the total output within a 24-hour period of each drain. It is very important to be diligent and fill this out and bring it to each post-op appointment. We will keep track of how much your drains are outputting, and if they're below 30 cc's within a 24-hour period, we will pull your drains. So as we discussed previously, this is the end that will be in your body. It is very important to be mindful of your drains and not snag or pull them on anything. There will be a small black suture that is holding this in place. If your drain would happen to be dislodged or pulled out and would lose suction, it is very important not to push your drains back in place. This is not an emergency and you do not need to call the after hours line for this. Just simply secure it with a piece of tape and contact us during regular business hours on the nurse line. Our normal business hours are between 8 and 5. You can either call the Powell location or the Cherokee Plaza location and ask to be connected to a nurse, or call the nurse line directly. Now, if the drain happened to become completely dislodged from your body, you can place an ABD pad or a piece of gauze at the incision site to catch any of the drainage that may follow. Now, if your drain is dislodged but the black suture is still connected and in place, you can simply put a piece of gauze around the incision site to catch any of the extra leakage. Now I will demonstrate how to properly strip your JP drain. When you go to strip a drain, you're always going to release the suction first. This is going to reduce any resistance. And you can put this down at a lower level. You're going to hold at the incision site. And I like to use a tongue depressor. I find it's a little bit easier to get a grip. And you're just going to pull away from the body and into the bulb. You can also use your fingers like so. When you're done stripping the drain, make sure you always suction it back. This will aid the drainage process. Once you're done stripping your drain, you can open this little top part and pour the drainage into a cup and either dispose of it in a biohazard bag or flush it down the toilet. So one of the most common questions we get here at Gallaher Plastic Surgery and Spa MD is if the color of the drainage is acceptable. So you'll notice throughout your healing process, the color of your drainage is going to change. It might be super dark, super light, and I have some examples for you. So these right here are all completely normal drainage colors that we would expect to see for a post-surgery patient. So a common concern that we have are the blood clots that would happen to be in the bulb or in the drainage tube. Some blood that has some clotting in it, like so, and this is completely okay and nothing to be alarmed about. And this is why it is so important to strip your drains. You don't want those clots to form in the tube and then keep the rest of the drainage from being able to make it down to the bulb. If there's a larger clot in there, it can accumulate around the incision site and then seep out of the wound. If you start to notice seepage, just try to strip your drain, again holding at the top of the suture and pulling a downward motion. Even if it looks like there's nothing in the tube, continue to strip the drain just in case it could be blocking around the incision site. It is so important to keep your drain in the dependent position because doing so and having the bulb suctioned is going to help get all of that fluid out of your body. Lastly, I just wanted to thank y'all for watching my video and for choosing Gallaher Plastic Surgery and Spa MD. If you have any questions, please contact me on the nurse line. Again, my name is Kaylan, and of course, if you think it is an emergency, do not hesitate to contact our after-hours service. We'll see you next time.